Two studies are showing weight loss treatments can lead to a significant reduction in blood pressure. And this isn't just about the drugs that are having a positive effect. Joining us now to talk about that and some other health topics today is Dr. Bill Hartman, clinical trialist at UW Health. Let's talk more about this, Dr. Hartman. It is American Heart Health Month, and with news of blood pressure dropping, this is a good thing. Can you explain more about these interventions and then subsequent outcomes?
Sure. So obesity has long been tied to cardiac effects and things like high blood pressure, diabetes, and other heart conditions like congestive heart failure. And the problem was we never had effective treatments for obesity before, so it was difficult to measure how much obesity contributed to these different cardiac scenarios. And now we have good treatments. We have gastric bypass surgery, and we have these medicines, these GLP-1 agonists, that are very effective in treating obesity. But the long-term effects actually might have more benefit than just treating the obesity itself. The medicines, Mounjaro and Zepbound, these GLP-1s used to treat diabetes, used to treat obesity, showed that if people took them for 9 months, not only did they get a significant reduction in their weight, but their blood pressure went down as well. This decreases things like stroke, decreases chance of heart attacks. So there's a lot of benefit. Similarly, in patients who've received a gastric bypass operation to treat their obesity, they've also seen a decrease in blood pressure. This is very important because 47% of adults are diagnosed with high blood pressure with hypertension, and 75% of these can be attributed to obesity. So getting the obesity under control is obviously going to have a long-term benefit of keeping people's blood pressure under control, decreasing heart disease overall.
Killing two birds with one stone. In this case, it's a very good thing. You know, there is an interesting correlation being made between erectile dysfunction drugs like Viagra and the reduction of Alzheimer's disease risk. Can you explain this one and what it could mean?
Well, this is more of an association at this point, but we do know that Viagra was originally developed to treat high blood pressure and angina or chest pain. It's still being used to treat pulmonary hypertension, a serious cardiac condition. But obviously, its most famous purpose is something very different than these. It's to treat erectile dysfunction. But what they saw is that the mechanism by which this drug works, the molecule that it works on, probably has a beneficial effect to protect the brain. And they've seen this in animal studies. And so a group in London looked to see whether or not men treated with Viagra had lower incidence of Alzheimer's compared to those not treated with Viagra. And what they found was that, in fact, there was this significant reduction in Alzheimer's disease in men who were treated with Viagra. And interestingly enough, those that had the most prescriptions for Viagra had the least chance of developing Alzheimer's disease.
That is fascinatingly interesting. I'm sure we'll be hearing more about this. Dr. Hartman, we appreciate it. Thank you.
Thank you.